You have been told that iodine is essential for your thyroid gland, and that iodine deficiency is the reason you got hypothyroidism or Hashimoto's disease. But here's the shocking truth. For some people, iodine might be destroying their thyroid gland. I have seen patients dramatically improving with iodine, and some others who have gotten really worse after taking iodine supplementation. So what is really going on? Is iodine really good for your thyroid, or is it a thyroid killer? So in today's video, I'm going to discuss the most controversial topic in thyroid history, whether iodine is good or bad for your thyroid, and I'm going to back it with all the science that we have currently available, and more importantly, what you should be doing if you do have a thyroid disorder, whether you should take iodine or avoid iodine. Hi, I'm Dr. Anshul Gupta, a former Cleveland Clinic functional medicine physician in US. I help people reverse their thyroid conditions by making personalized functional medicine plans. So let me start over here with sharing a story about one of my clients called Maria. Maria was diagnosed with Hashimoto's disease and hypothyroidism. She started taking levothyroxine, but her thyroid antibody levels were not getting better, and some of her symptoms like feeling tired or fatigued and also feeling anxious were not getting better. She started searching on internet about what things she can do to improve her Hashimoto's and thyroid condition. And that's where she found this protocol which utilized high dose iodine to improve thyroid functioning. She started using high dose iodine. Within few weeks of starting this high dose iodine, she started feeling more anxious, she was more tired, and also had brain fog issues. When she did her blood work, to her surprise, her thyroid numbers have gotten worse. Especially her thyroid antibodies increased 5 times from what they were before. And this is not just one story. I keep on seeing this each and every day in my clinic, where people take high dose iodine supplementation and actually destroys their thyroid gland. So, but then, is iodine really that bad for your thyroid gland? No, it is not. Iodine is really important for your thyroid gland. It is a trace mineral which your body needs to actually make thyroid hormone, which is the T3 and the T4. In fact, the number T3 and the T4 means the number of iodine atoms which is attached to a molecule. So yes, without iodine, your body cannot make any thyroid hormone. That's the reason traditionally iodine deficiency has been linked to goiter and hypothyroidism. So now you heard both the contrasting details. Too much iodine destroyed Maria's thyroid gland, and iodine deficiency can also lead to hypothyroidism also. And I am sure you are totally confused over here. So let me share with you what is actually happening between your thyroid and your iodine. So the new research shows that for having proper thyroid function, you need something called optimal iodine balance. And this balance is the key to having healthy thyroid function. Now, what is this optimal iodine balance? This means that you need the right amount of iodine in the right form, as well as you need to take right supporting nutrients with the iodine so that it can benefit your thyroid gland and not damage it. There are now research studies which shows that people who have low iodine levels have higher chances of hypothyroidism and Hashimoto's disease, and people who are consuming very high amount of iodine in their diet or through supplementation also have higher chances of hypothyroidism and Hashimoto's disease. So that's the reason the optimal thyroid balance is the key over here. Especially for people who have Hashimoto's disease, which is an autoimmune condition for your thyroid gland, where your body is making antibodies against your thyroid gland. It is very important to follow an optimal iodine balance, because a dysfunction in your iodine can lead to increase in your antibody levels and can make your Hashimoto's worse. In fact, there was a research study done in China which compared regions in China with high iodine consumption as compared to the other areas which have low iodine consumption. And it showed that in areas where there was excessive iodine consumption, there was higher risk for having hypothyroidism and Hashimoto's disease. Now the next question is that how do you know whether your body has enough iodine or not? And this is where the modern science is still struggling. We do not have a perfect test to check for iodine levels in the body. We have a blood test to check for iodine as well as a urine test to check for iodine. Both of those tests are not perfect, but they can be used as a guide to know where your iodine levels might be. The reason being, the levels of both of these tests can be affected by the iodine consumption through your food as well as through supplementation. Plus, the lab values can also be affected with the food you have consumed the day before, including cruciferous foods or also certain foods which are high in antioxidants. But currently, the best test to check for iodine levels is to check your urine iodine levels, because that is little bit more stable as compared to your blood iodine levels. And if your levels are really on the lower side, then you can know that you need more iodine in your diet or through supplementation. Or if your levels are showing very high on this test, then you know that iodine is not a good choice for you. Now, on internet or online, people are propagating a skin iodine test, which unfortunately doesn't have any science or research behind it. So I do not recommend that for my patients. Okay, now the big question, is iodine good or bad for you? So let me tell you some guidelines that you can utilize that might help you to make a decision whether iodine is good for you or not and how to take it. Now, the first important thing to know is that you never take iodine on its own. You have to take selenium with it. Now, what is selenium? Selenium is an important mineral which is a part of enzyme called deiodinases in your thyroid gland. The role of this enzyme is to neutralize hydrogen peroxide, which is produced during iodine metabolism to produce thyroid hormone. Now, whenever your body is low in selenium, when you take high doses of iodine, that actually harms your thyroid gland. So first of all, very important that when you're taking an iodine supplementation, either through food or through supplements, make sure you're taking a selenium supplementations along with it. The typical dosage of selenium supplementation is between 100 to 200 micrograms. The second thing is that get your iodine levels checked, whether urine or blood levels. If your levels are low or on the low normal side, then only you take iodine supplementation. If your levels are on the high side, it is better to avoid iodine supplementation. How to start supplementation? Always start with the lowest dose possible, which can be around 100 micrograms, and then slowly build it up. And if you can include iodine rich foods, that is the first step to do, which include seafood, sea vegetables, as well as iodized salt over here. And then always pair with taking iodine with an anti-inflammatory diet, because if there is any reactive oxygen species developing when you're taking iodine, the anti-inflammatory diet will take care of those reactive oxygen species for you. And then it is also very important to monitor your labs when you're taking iodine supplementation. So make sure you are doing your TSH, your free T3, free T4, as well as the thyroid antibodies, which is the thyroid peroxidase and the thyroglobulin antibodies, so that if you see your labs getting worse, you know that you need to stop your iodine consumption. So is iodine really a miracle for your thyroid gland or your thyroid killer? The truth is, it all depends on your unique biology as well as the levels of iodine in your body and what foods you're consuming which are high in iodine. That's the reason I wanted to make this video and share the latest research on iodine, so that you don't follow online dangerous trends which can actually be harmful for you. In this aspect, as you know, I have created a special thyroid balance supplements which has synergistic ingredients of selenium, zinc, very small dose of iodine, L-tyrosine and other adaptogenic herbs which work really good together to support your thyroid gland. The link will be in the description if you want to buy it. So here you go. Now you have the complete science behind whether iodine is good or bad for you. I hope you like this video. If you do, please like and subscribe to my channel as well as share this video with others who can benefit from this great information. Until next time, take care. Bye-bye.